name is Michael Landsberg, and I will be the facilitator largely. I have a charity called SickNotWeak that, when I say I, me and a whole community of people, we use the hashtag SickNotWeak. Our goal is to show people that mental illness is a sickness, not a weakness, hence the word SickNotWeak. And I am joined today by two guys who have an expertise in many things that I don't, including pharmacy. To my left, which would be to your right, Andrew Schonbe joins us, pharmacist, educator. Good to see you, man.
Good to see you.
Barry, right?
That's
Two
correct.
pharmacies.
That's right.
And to my right and to your left, James Morrison. James, a pharmacist,
Yeah,
educator.
that's right.
All right. Did I miss anything?
That's a good summary.
Okay.
To the point.
You know, so we're here to talk about specific needs and issues that might exist in the LGBT community when it comes to mental health, when it comes to the role that you guys play as pharmacists. And, you know, in a lot of ways, I'm here as a facilitator because I want to know what some of the answers are. So why don't you start us off? Why are we doing this? Why is there need for something specific to the LGBTQ community?
Okay, so the reason why is you kind of have a bit of a double stigma for people who are identified within the community. Because if they experience mental health, as you mentioned, there is stigma associated. And if you also do identify within the LGBTQ plus community, there's also stigma there. So it's kind of like a double stigma. And sometimes having that stigma can also feed into mental health as well.
Yeah, it also, having that double stigma also relates to how you might access help or seek care when you're suffering from a mental illness, because the society or healthcare might stigmatize you for both reasons. So it might be even more challenging.
Oh yeah, there's no doubt. The only thing worse than one stigma, you know, would probably be two. Mm-hmm. So why are we doing this month? Obviously, this is Pride Month, right? And this past weekend was Pride Weekend in Toronto, which is a great time to do this because there's awareness in the and I apologize in advance if I use a phrase that maybe isn't bang on. It's like when I go to speak about mental health, people use phrases that sometimes aren't the best choices, but I never get mad because, you know, like there's no, like for instance, I was using this example to you before, the term committed suicide, we know is not a good term, right? Because, you know, it's based back to a time when you took your own life. If you did, you had committed a crime. And I think it's only really bad when you use that and you know what you're doing. But if you have no idea what the basis is, then it's not a problem. So I guess what I'm saying is that from the straight community, this is a really good month to do this because we are aware of LGBTQ more at this time than we are at any other time.
For sure. As people know, this is generally Pride Month, although there are Pride events throughout the summer, depending on where you live. And essentially the history with Pride, it kind of really started out of the Stonewall riots in 1969, where LGBTQ plus people were being persecuted, they were being charged, attacked by the police, and it was really an uprising. It was really a protest to kind of say, hey, you know, we have rights too, and that's kind of what it kind of has fed out of. And of course, we've made lots of progress over the years, but we'll talk later that even in 2019, we still do have that challenge with things like stigma and discrimination still in play.
Did you notice James was having a little conversation with someone off camera?
Did you notice that? Did you notice the tables gradually sliding into us?
Oh, really?
No, I didn't. Actually, you know what? I just tried to cross my legs, and it was a little closer than I anticipated.
It's not me and Andrew invading your space. It's the
That's
table
I wasn't feeling invaded.
creeping up on us.
So, statistically, the issues that exist in the LGBTQ community, I believe from what you've said, and not surprisingly given the double stigma, are more profound than they are in the straight population, or if you look at the general population. I'm sure they're all identical problems, they're just magnified. Would that be a fair way to say it?
Similar but unique. I wouldn't say identical problems. No, we have unique challenges in the LGBT community. For example, discrepancy with the body you're living in compared to how you feel inside. So that's something that, you know, heterosexual people never have to deal with. Or, you know, the whole stigma of being attracted to someone of the same physical sex, which historically has been unacceptable, it's been illegal, as you said, criminal elements compared to suicide. So there's additional barriers that LGBT people have faced.
Or things like even just coming out. So generally, if somebody identifies as straight, it's assumed that you are straight. So to have this secret or something that you have to kind of express so people understand you and you can kind of live your life, it's an extra form of stress, anxiety, pressure for individuals that people who don't identify within the community would have to face.
So let me rephrase that and say that people in the LGBT community would experience all of the same issues that people in the straight community would experience, plus more. I mean, regardless of your sexual preference or your sexuality, you would suffer in that population from things like depression and anxiety and bipolar, things that I always look at as being physical illnesses of the brain. But then there's a whole host of other problems statistically. Tell us more.
Yeah, so when we compare the youth, LGBT youth, and this was in all of the promo for this webinar, we talked about how there's a 14 times higher risk of substance use and suicide when we compare to the heterosexual community, and that was one of the main impotents that we wanted to get out here and talk about this today.
Sorry, say that again. 14 times greater risk of addiction
and suicide. Yeah.
That's extremely profound, because we know the incidence of suicide and addiction in did you say the heterosexual community or the straight community?
Well,
I guess you would identify heterosexually.
Okay, then, I mean, obviously it's a huge issue in the heterosexual community. So if you multiply that by 14, it's really scary.
Yeah, and it's true. There was, I posted it on my own Facebook, and there was a comment from a man who said, but teen suicide in general is so severe right now, all of our kids are at risk. And then in my mind, I think, what if you had a teen that is, dealing with their sexuality, the risk is heightened even more. So we really need to give that some attention. Or
their gender identity or their gender expression as well, right?
Yeah, I realized I was slouching. I realized, seriously, I'm sitting back here and I'm going, oh my God, like
it's good to relax.
No, but look at the size compared to the two of you guys. So I'm gonna,
we'll kind of crouch together.
No. So on top of that, Michael, if we look at the transgender community in particular, 45% in an Ontario survey had attempted suicide. So that's almost half. So that is 45% in that survey. So
it's tragic.
So when we look at some of the other mental illnesses, most of them tend to be higher incidence in LGBT community. We talked about substance use disorder, but also anxiety, depression, OCD, self-harm, PTSD. And, in Canada, we have a lot of hate crimes motivated by sexual orientation, and they've been gradually increasing year over year. One of my patients last week was in a parking lot outside the mall in Burlington, and he was approached by 3 men and beat, and they ripped his head open and broke his arm. And he didn't know them, and we don't know how they knew of his orientation, but this is still happening, and it's something that LGBT people often think about when they're going out in public. Is this going to be the day that somebody comes at me?
So you both done a good job of highlighting the problem. Mm-hmm. That's only a small part of the battle, right? Now it's like, what can we do? Which is why we're here today. How do we address this? What are the important issues? Where do we start?
Well, I guess we have to kind of really say, why are the statistics the way they are? And we kind of mentioned it earlier on talking about dealing with things like gender dysphoria, where maybe you're assigned a different gender than how you identify when you're born. Things like bullying, intimidation, assaults because of sexuality, impacts in the workplace. So there's several things. It could also be while anyone can really get HIV, you can be any gender, any sexual orientation. What they call MSM, or men who have sex with men, tend to are at increased risk for HIV. And if you have people from the community who were alive during, let's say, the AIDS crisis in the 80s, where it was a very scary time when people, their friends and people around them were getting sick and dying, and meanwhile being discriminated, meanwhile being rejected, meanwhile dealing with discrimination all throughout wherever they were. It was a chaotic time. And then to now be alive as, let's say, a gay senior, and they're not alive anymore, and experiencing things like PTSD. So there's a lot happening here. So it's very complex.
By the way, if you'd like to ask a question on either Zoom or Facebook, do so. And we've got a whole gang behind the camera. Oh my God, the crew is massive here. And they'll shout out to
all this?
and catered as well.
That's right.
Yeah. By the way, we're in my house, and you might wonder if you follow SickNotWeak, you might wonder where's the dog. Well, the dog didn't make the cut, unfortunately, and was taken out of the house for fear of misbehaving. Okay, so let's focus on what we can do. And I got some questions because I am sort of in this conversation. I'm the layman, right? I'm in a world that I don't understand. And that goes from many aspects, including the expertise, obviously, that you guys have in pharmacy. Mm-hmm. First of all, as pharmacists, how does that relate to what we're doing today?
Well, we help provide care to the public, and we are spaces that we're very accessible as pharmacists. We're one of the most accessible healthcare professionals to provide an environment where people feel welcome, where people can access the care and get the respect and the understanding that really they should, just like any other patient.
Yeah, there's been a number of examples where that has gone awry in particular, and real world examples that we have seen personally or that have been in the news. For example, in the US, there was a trans woman trying to access her hormone therapy at a pharmacy, and she went in there to fill the prescription, and the pharmacist asked her a lot of intimate questions, and because there was a discrepancy with what her gender assigned at birth versus how she was expressing herself, and the pharmacist actually made a big scene in the pharmacy, humiliated this woman, and she was refused care. So it really it's a very important issue. Andrew, did you want to comment on that?
Yeah, I would say it comes up a lot where people possibly either A, don't respect confidentiality and kind of make a scene, but also the sense of refusing or referring people. And while some people, have their own internal beliefs with whether they should refer people, and each college, like pharmacy college and physicians, each have kind of their own statements on what people can do, anyone who's going to be thinking that that's something they want to do should really think about how does it impact the individual? If you refuse something, if you refer someone based on, like, say, their sexual orientation or their gender identity, how does that make them feel? If you put yourself in their shoes, that causes feelings of shame. It causes anxiety. It causes distrust with healthcare professionals. And studies have shown that patients are less inclined to seek out care because of these kind of experiences or because of these fear. And this patient may have also been referred multiple times or refused multiple times elsewhere. So it's kind of this continual rejection.
Yeah, so if you don't want to help them, you can send them to Andrew and Barry. He'd be happy to take care of them.
So if you're watching right now in Mexico, you got a long haul to get up to Andrew and Barry, but we kind of believe it'll be worth the journey.
If you're watching right now, I suggest you really become more familiar and understand the impacts the things that you do in your practice, and by you doing something, how does it impact a patient? Before you decide to refuse something or send somebody somewhere else, what's the actual outcome? What's the actual harm of doing that?
Right, but why would you send somebody to someplace else? I don't understand that.
Some healthcare professionals, they bring in their personal beliefs into their practice, things like religion or values, cultural differences, and they use that as a reason why they can't provide care.
And we're talking about pharmacists now. Do you take an oath as a pharmacist?
We do have some oath to care and wellness.
Right. I would imagine that probably goes against what it is you're taught and what your expectations are of you.
Yeah. I mean, it's a really, I don't want to go too far into it. It's really a complicated discussion on rights of individuals practicing in general and human rights and how you kind of impact yours with somebody else's. But ultimately, I think people really need to focus on helping people in practice.
Right. Yeah. But that's, sorry, because this is, like, there's a crossover here to something that I talk a lot about on behalf of whole health, and that's the idea that the pharmacist has, especially in the area of psychotropic drugs, has the ability to make a huge difference in someone's life because of the unique nature of those drugs and because of the stigma attached to those drugs and because of the stigma attached to someone who's walking in perhaps for the first time and is filling a prescription for an antidepressant. Like, I don't think there's a stigma around antibiotics, for instance, where someone goes, oh my God, I don't want anyone to find out I'm on amoxicillin. But that's a huge factor with antidepressants, and that's something that the two of you, as practitioners, can make a big difference in.
Yeah, I agree with you wholeheartedly. I spend a lot of time when I'm talking to people about mental health that we really need to make it the same as talking about your blood pressure or your diabetes. It shouldn't be something that we have to hide. It's very important that we can disclose to those people around us because they can play an important part in our wellness as well.
Don't forget, while we're here to talk about LGBTQ, mental health, and we want to know what your questions are. So fire away. Do we want to take some questions now, or do we want to continue to be informed by the three people performing?
So an example that we gave was quite severe about a pharmacist rejecting a trans woman, but there's other more simple ways that pharmacists can make LGBT people feel unwelcome, and something as simple as not using the right pronoun to address a person. So we really shouldn't assume what pronoun an individual wants to
Give me an
use.
example.
So say there's a patient transitioning, walking into the pharmacy, and currently, if I were to look at them, they appear as a man, but they've decided that they want to be called by a different name or a different pronoun, and if I don't respect that, it can actually cause distress to that individual.
I'm sure. Now, what would be the appropriate way to sort of bridge the gap between being inappropriate like that and being appropriate? Would you ask the question?
Yeah, so Andrew, what do you find works best in your pharmacy?
So in our practice, the easiest thing is if you don't know somebody well, you just address them by their name. If they come in to bring a prescription, just address them by their name. You don't have to worry about him, her in context.
Mr. or Mrs.
Yeah, you can refer to, if you are referring to them, you can say them or they, which is, you can't really go wrong doing that. And in our pharmacy specifically, we have signs actually saying that we are a welcoming space for all, and if you have any requests of any type, whether it's pronouns or anything, to let us know. And that way people feel comfortable and they feel they can tell you, because sometimes asking someone for the pronouns, you can do, but sometimes it's difficult.
Right, but would you not agree, and again, as I might be that person in that setting who is not as conversant in what to say, and sometimes I think that you're better off asking than you are assuming.
Yes.
Yeah, if you come down to that point, for sure. But honestly, just call them by their name. It's the easiest thing to do for anybody.
Yeah, and then you go pick up on the language they use to describe themselves and the people around them. So, we shouldn't assume somebody's the gender of their spouse, for example. So if they haven't brought that forward, you can listen to the words they say. If they describe "this is my wife," then you should refer to your wife. Or if they say "this is my boyfriend," you should use the same language that they use, rather than using our own terminology.
I mean, to put it kind of in a real world example. So let's say someone comes to the pharmacy, they have a drug card, and the pharmacist asks, "Oh, is this your wife's card?" Instead of saying that, just say, "Oh, is this your partner?" or is this, or even say, "Is this a family member's card?" And that way you can kind of navigate a little easier. And for people who are kind of watching that are saying, "Hey, there's a lot of things to know and change," it's a process. For people who have been doing this from the start, it's not that hard. It's pretty regular. But if you're not used to it, it's a process, and you eventually get used to doing this and making sure it's a welcoming space for everybody.
We have one question here. Messiah is saying...
Speak up.
Sorry, Messiah. Hopefully I'm saying her name correctly. Messiah is saying thank you for addressing the topic. She'd like to hear a little bit more around the stigma and actions that you can take within your dispensary and your pharmacy to help overcome stigma.
Okay, so I'll just repeat that in case people didn't hear. The first part was, I'm going to expand on it a bit. Thank you so much for doing this. This is like the greatest half hour of my life ever right now. I feel like I'm learning so much. But also, in addressing the stigma in the pharmacy setting, expand on what the pharmacist can do in that area.
So the slide we have up right now does speak a little bit to that, and we touched on some of those elements already. A very important one is to intervene on offensive behavior. So, like myself, I'm a pharmacy manager. So in my practice, I listen very carefully to the way that people are communicating with patients. And if you hear people around you, whether it's at work or elsewhere, using terms or language that could be, disturbing to an LGBT person, you have an opportunity there to help and create a better world for all of us.
So, but before you jump in, so you are a pharmacy manager. Now, does that pharmacy cater in particular to LGBTQ, or is it like for instance, I go to the Shoppers Drug Mart, around the corner from here.
Yeah. So I serve a generalist population.
Right.
And I actually work in a Walmart, and we have, a number of LGBTQ employees at the Walmart, as well as patients that come to the pharmacy. So I do have a lot of experience. But in my history of working in pharmacies, I have seen days when other individuals, while I was a student working with other preceptors, when the local trans patient walks in, it's like a joke to the staff, and it's quite disturbing. Like, they all snicker as they're leaving, and imagine if that individual has seen that. So we really need to work hard to correct those kind of behaviors.
Right. So what I'm interested in is how proactive have you been as the manager, right? How many people work, how many people do you manage?
So about 10.
About 10 people.
I think Andrew's done a lot of work in this area.
Okay, well, I don't care what Andrew has to say right now. I'm talking about you because Andrew, you have two pharmacies, right?
Correct,
In Barrie.
yes.
And both of those pharmacies, in particular, you have made it known that you are LGBTQ, I don't know, friendly is the right word, inclusive. So, but James works at a general pharmacy, and my question is, how do you prepare your staff to deal in the appropriate way, doing the right things as opposed to the wrong things? Because as we all know, people instinctively don't necessarily know the right way to handle it.
Right. So at my employer, we actually have cultural sensitivity training. So we all go and we do modules and, giving examples of language that is not appropriate and language that is appropriate, and how to respect each other. It's not just around LGBTQ, but all cultures.
Right, of course, yeah.
For sure.
Okay, now it's your turn.
All right. So here's kind of a list. If let's say you are in practice where you can have more direction, let's say you're an independent or you have a fairly flexible employer, what we did at our pharmacies were to create a safer space. And I'm going to kind of share with you what that would include. And a lot of it's more being proactive than being reactive. So proactive means that you're going to basically get training, like James has mentioned. If you are in a community and you're looking for training, often if you reach out to local LGBTQ plus organizations, they may have some sort of training. I was fortunate in Barrie, we actually had a set safer space training, and all my team came there. They learned about diversity, they learned about addressing in different issues and understanding the community better. Now, one training isn't going to teach everybody everything, but it kind of gets the ball rolling. After that, you want to have some policies in place. How are you going to interact with people? How are you going to handle different situations? And you can kind of develop that with your team. And I think we kind of touched on some of these things. How do you handle it if somebody who's transgender, how are you going to handle it if they want to be addressed a certain way? How are you going to document that in your software? How are you going to keep track of that? Perhaps they want their name that maybe isn't on their health card or on their insurance card. They want a different name on their prescription label. How are you going to navigate that? Which you can solve. So there's a few things to do. You can also put up signage saying that you're a safer space. You can have little notes at the counter saying if people have preferences, let them know. And it's not a big deal giving people preferences and choices. We do special things for patients all the time. We do free delivery. We split pills. So if somebody wants just their name on a label differently than on their insurance card, it's really not a big ask. Mm-hmm. So those are some kind of things to kind of go from.
Yeah, so you mentioned a couple things that an LGBT person could see walking into a pharmacy. There's a couple more you didn't quite touch on. So in particular, LGBT people accessing any sort of healthcare space, they kind of look around for hints because some of them are quite nervous. Walking in there, they don't know how they're going to be received. So some things they'll look for is posted policies. I think you did mention that. Mm-hmm. And businesses, pharmacies can put up the rainbow triangles. LGBT people are all aware of that, and they look for that to know that they're welcome. And also Genderless washrooms that are not assigned to male or female. That's another one that we can provide to make them feel more comfortable.
Or even signage as well, being integrated. So I remember when the flu campaign ran out with Whole Health, they actually helped me get signs showing diversity in photos. So it wasn't just classic photos. We actually had two husbands with their children in a photo. And it's just that understanding and relatability for people. And one thing I do want to say before anyone jumps in here is, once you offer these and you're providing a safer space and you're marketing that, some people seem to sometimes see it as a business opportunity and say, hey, we're for the LGBTQ plus community, we have a sign up. You need to really live it and really be true to it, because a lot of companies tend to jump on the bandwagon but don't really deliver services or things for the community. And with that being said, you should understand medications that the community might be using. So be familiar with gender-affirming medications. Be familiar with, so that you can educate on them, or that you can help with access or billing for them, okay? Or maybe carrying different gauges for needles for people who are injecting hormones, which can be hard to find depending on where you go. So it's these little things that really make a huge difference, but you need to be able to know the community. You can't just have a sign up.
Yeah, little things are important and they do make a difference, but Andrew and his pharmacy has actually done a number of larger scheme things that help these patients. And we talked a little about how LGBT community has a higher risk of substance use disorder. So in Andrew's pharmacy, he actually hosts local learning opportunities. People come into the pharmacy, they have experts come in and do presentations and even group discussions about mental health and addictions treatment services. And also offering addictions treatment services is important if you really want to be that pharmacy that's there for LGBTQ people, making it comprehensive so we can cover all of the issues that we face. It's very important.
If you got a question, fire away. I got lots of questions, but people should, communicate those to us, and we'll receive them. Yeah.
Yeah, there's one here. Some of them are just sharing in acknowledging of what you're saying. So one of them is around the pronouns. The suggestion is finding a way in your conversation to introduce yourself with your own pronoun to show an understanding.
Okay, let me share that, because they might not hear. The idea is the use of pronouns and the effectiveness of introducing yourself with your own pronoun, right?
Right.
Right.
Exactly.
So Andrew, at the last conference we were at, Andrew actually wrote he, him right on his name badge so that anybody there would know that he's open to that conversation. He knows.
What did he write? I'm sorry, I missed that.
He wrote he/him.
Oh,
so
okay.
his preferred pronouns, and on his name badge. So it kind of shows a sign to other people that he wants to know what's your preferred pronoun as well, so we can treat you with respect.
So literally, even on your name badge, like if at somewhere you're working, like in a pharmacy, you literally under your name you actually put your pronouns, and then that kind of a little thing says a whole lot to somebody who's coming in.
Oh, for sure, and I mean that's true in I think every aspect of what we're talking about. I mean the problems that you're talking about would be I think an issue in all kinds of areas. People you just want to make them feel like it's a safe spot. Right,
absolutely,
and that's true for heterosexual people who are going to pick up a prescription that maybe they have not felt comfortable with in the past, and in particular, like I said before, that exists with psychotropic drugs in ways that really doesn't exist in anything else. And you have a safe area, right? I would imagine. So if I come in and I'm picking up my my prescription for Cipralex. And I have a lot of questions about it, but I'm not really comfortable with the person behind me in line hearing me talk about it. How can you make me comfortable?
It's really important for pharmacists to look for those cues and be observant of nonverbals, because sometimes patients are not going to raise their voice. They're not going to know that they have the opportunity to go speak privately. And most provinces now we have private consultation rooms, so if you need to really have a one-on-one with the pharmacist should be able to assess the situation and offer privacy, even if you decline, like at least giving you the opportunity to go there and really have an in-depth private conversation about your mental health is very important.
Can I teach you guys something here?
Absolutely.
as the person on the other side of the counter and as a person that is an advocate for those who struggle with mental health challenges, you have to, as the pharmacist, assume that that person, especially when they're starting on a new drug, has never been explained the complexities, for instance, of antidepressants. Almost unlike any other drug. I mean, people every day, not every day, a couple times a week, I'll hear from someone who goes, I'm really freaked out. I started on Celexa 3 days ago, and it's not working. And it's like, well, did your doctor not tell you that these drugs take a while, to build up in your system? No. That's the kind of thing that can be devastating, right? I start on a drug, I think it's going to work right away. Like if you're taking a painkiller and it doesn't work after an hour, it's probably not going to work.
Yeah, I agree with you. Like those conversations as a pharmacist are always very disheartening to hear because somebody in a pharmacy somewhere dropped the ball. Like it's our job to spend that time with the patient and help them understand better what's the drug therapy and really what to expect.
But I think even not just the first time, I find sometimes we get a little bit, we just kind of see a profile and we just see a basket to fill sometimes, and we kind of lose sight that this person is still facing this all the time. So even though they're getting a refill for their antidepressant or for their hormone medication, that it's still very real for them. And we need to really have that conversation with them and not just be as like, okay, here's your medication, see ya.
What would you do in this situation? First of all, would you say it would be appropriate to ask somebody, let's say after 6 weeks, to say to them, how you doing? How you doing with your drug? You're taking this drug obviously for a specific reason to treat an illness. Is it appropriate for the pharmacist to say, are you getting benefit from this?
Absolutely, yeah. But of course, it might be a private conversation.
Right.
But yes.
But yeah, absolutely.
Okay, so I'm taking this someplace. So then would it be appropriate for you to say, if they say no, I feel really crappy, for you to say, well, you should probably go discuss this with your doctor because you've been on this drug for a long enough period of time at this dose that, if it's not working now, that is a reason to address it.
Absolutely.
Yeah, and even in some jurisdictions, not in Ontario but other provinces, pharmacists can substitute therapies. So if you're already on one antidepressant and they're finding you're not benefiting, they actually have the power that they could help you transition to another one and give another one a shot. Because you're right, Michael, sometimes the first one doesn't work, sometimes the second one doesn't work. So it does take a few tries sometimes.
Yeah, I mean, sometimes it's the wrong dose, sometimes add a medication. I mean, it's such a feel kind of science, right? I mean, if you go to cardiologists, right, and you have certain symptoms, every cardiologist in Canada would probably prescribe you the same regimen of drugs. But with psychiatric issues, you might get 50 different ideas on how to treat someone, and it's just way more complicated. And what you could do also in this situation is just have me underneath like the table. So you say, oh, look at Michael's right here. And then I pop up and say, hey, I want to ask you some questions. Yeah.
Yeah, but I think for sure. I think for sure. I think when people start medication in general, it doesn't make a difference what they're on. It could be for mental health, it could be for LGBTQ plus related, is to really follow up with them. Once they start something, give them a call, see how they are. And before each refill, just kind of see like, hey, how are things going? We do that in our pharmacy. We always document. We see, how things are going, and
No one's ever asked me that.
I know.
I've been on Cipralex, Escitalopram, and Wellbutrin for. I've been on all kinds of drugs, but I've been on these two drugs for 10 years, and nobody has ever said, yeah, how you doing? Especially, after, if you fill the same prescription for someone for that long, if you look on the file, it would be totally appropriate to ask the question, are you still doing well, right? Because sometimes you build up an immunity to a drug and you need someone to inspire you to go back to your doctor, for instance.
For sure. There's no checks and balances.
So what haven't we touched on here? Yeah, we have a question from the studio audience.
Yes, so there's a request that says pharmacists and their teams should maybe learn to understand some of the drugs a little bit more. So they find often that antiretroviral medications are often misunderstood and not realized what they're used for, and it's a miss. And he's asking around how you encourage that within your teams to learn more about those
Okay,
drugs.
so let me just repeat what the question was. Dealing with specific drugs that maybe are not as well known to the pharmacist, like retrovirals, right?
So with HIV, we have a whole large group of medications we can use. And some of them are used for prevention, some of them are used for treatment. And that's an area where a lot of pharmacists kind of get a little bit muddled. And like Andrew, what do you find works best with your teams in helping them with this?
I can tell you right now what you should do. The biggest confusion is often comparing treatment, PrEP, so pre-exposure prophylaxis, so you take prior to a risk exposure, and PEP, so post-exposure prophylaxis you take after. There's a really good Canadian guideline document out that basically has the PrEP and PEP guidelines. Best pass that along. It's a great summary. It's not a lot of pages. You can learn a lot through that. And then when it comes to antiretrovirals in general, the general thing to really know is that typically somebody should be on 3 different ones combined. There is an exception to that. But typically, if somebody comes in and just they're on one antiretroviral drug with no other ingredients in it, that's a big flag.
Yeah, so privately confirm the indication.
Yeah.
So respectfully, because that's another issue where there's been cases, pharmacists calling out patients' antiretrovirals over the counter in public, and that's a very private matter. So it takes a lot of delicacy and care. And also a shout out that if you're interested in pharmacists with PrEP and PEP, watch for in the fall, I think is coming out, a CE lesson that Andrew and I wrote together on the pharmacist role with PrEP and PEP. So hopefully some of you will have a look at that.
Yeah, I would say, as kind of James had mentioned, so if somebody is on Truvada, which is used for PrEP, if that's combined with another antiretroviral, it could be for treatment. So it's very important to ask why they're on it, or they might actually be on it in combination with something else for PEP. So it's good to ask, is it for treatment, is it for PrEP, or for PEP?
Yeah, and there was a case recently, I think it was Saskatchewan or Alberta, one of the prairie provinces, where a pharmacist was managing a patient and some of the antiretrovirals fell off the profile so that they were no longer on an effective HIV treatment. So we have a really important role there as well.
So we don't have a ton more time, to about 10 minutes. Question?
Just one more. There's a few people asking about the Rainbow Triangle and where to get, and some other folks are sharing how Gilbert Center offers the safe space training and potentially going through that training before you get your signage, as you were recommending. So is there a better other ways, or is that kind of where you suggest to go?
People are mentioning where do you go for training, essentially. If they're not that familiar with where they can go, I mean, if you're in the Barrie region or kind of in that central Ontario region, certainly reach out to the Gilbert Center, or really anyone can reach out to them. They're basically a really good center in Barrie, and that's where we had our training. You also could reach out to different organizations like maybe like PFLAG might have some idea of where to go. Rainbow Health Ontario might have possibly some referrals as well. So there's several places for that.
All right.
With that being the case too, I think we have a slide that had some resources. I don't know if that's the next one.
That's the one, yeah.
So there's several places to reach out to. That's what I would kind of check out. In addition to that, you should always have resources in your pharmacy. So usually we have brochures on like blood pressure or cholesterol, but have some on transitioning, have some on PrEP, have some on different topics that are relevant to the community as well. And also know where you can refer people when you don't know enough and you need to send somebody somewhere else.
What have we missed that you wanted to cover?
I think that pretty much hits on all of the major themes, Michael. You did a great job.
Well, you know what? Thank you. You know what? It's I'd just like to say thank you to everybody who assisted me in this process. I got a great team behind me, and I'm always intrigued by the boundaries that are appropriate for a pharmacist, whether it's in LGBTQ specific areas or just in general. For instance, if let's say you were filling prescription for me for Ativan, one of the dreaded benzos to me that are highly addictive, and not to suggest that they don't have a value, but when is it appropriate for you to say, to wonder, because doctors aren't necessarily always responsible for being aware of the fact that drugs like that can be highly addictive. When is it appropriate for the pharmacist to wonder, I'm not sure this is cool?
Yeah, I actually had that conversation at the first dispensing. We talk about, what's the need, how badly do they need that medication, and we talk about how did the doctor ask them to take it if they gave directions. but I generally try and tell people to use those as sparingly as possible.
I think, yeah, I actually have experience with it. I find when you've taken it, sometimes I had some insomnia years back, and I was on Ativan, lorazepam, and you never think about the problems with it, because sometimes we fill it so often for people, and we keep refilling, but getting off it is not always that easy, and sometimes not everybody tolerates it the same, and sometimes people need higher and higher doses very quickly. So when I was on it, I kind of experienced all those things. So pretty much anytime someone gets a script for those now, I'm much more alert, I'm much more heightened. I say, why are you taking this essentially? What's the plan of this? It generally shouldn't be taken more than 7 days if it's for sleep. And you can kind of give them the forewarning. It's really all about knowledge and passing it on to the patients and really knowing these drugs.
But it's one thing to know the drugs as the pharmacist. It's another thing to use your knowledge and to feel like, you know what, I got a stake in this patient because this is something very dear to me and near to me was, the whole benzodiazepine addiction. I mean, it in theory should have killed my brother. And it didn't, but it should have. He was taking 14 milligrams at a time by the end of his addiction. My brother's a doctor. He's a kidney doctor. And no one ever said to him, though, and not to say that it's a pharmacist's responsibility to manage somebody's life, but maybe if someone would have intervened and just put the idea in his head, this is going to be a disaster.
Especially early intervention is key for sure. If you can get that first conversation going or even that follow-up before it kind of becomes a 10-year habit, it's hard to deal with.
It also helps building relationships with your patients so you can support them in the long run because, coming off a high dose of a benzo is going to happen over several months. So it's really important to maintain that.
Happened to me. Yeah, not good.
Yeah.
Well, you're going to hear Wrigley in a second. He's going to be walking in. So get ready for some excitement here. Anything else you want to touch on before we say that's a wrap?
No, I think our last thing is really now is a great time. It's summertime. Not all places are doing Pride events in June. Some are doing it later. So if your local community is holding something or parade, just have some presence. It really shows support.
Yeah, that's great. And if you want to join Andrew at Barrie Pride, I'm sure he'd be happy to have some company.
We'll be there in August.
So you'll be there watching or taking part?
We usually, I don't know what's happening this year yet.
Case, it's okay. Let him go.
It hasn't been finalized yet. But essentially, last year what we did was we had a booth set up, educating on PrEP and PEP, and on sexual health in general, and then we marched in the parade as well. And I think we were the first pharmacy to do that in the region. So
I have marched in the Pride Parade in Toronto twice, under a banner of because I had a friend who lost a child who had just come out, and I just thought he needed my support, and it was. I thought it was one of the amazing experiences in my life, to be honest with you. And I learned a lot. And there's no doubt when you take part in something for a community that's not your community, immediately you feel closer to that community, and you feel like, hey, you know what? I understand them a bit better.
Yeah, and if you have an LGBT youth in your life and they don't have an LGBT mentor, try and find someone in your circle that can spend some time with them and help them through that process, because I think that's very beneficial.
So that's it. This has been great, very educational for me, and that's usually a good sign for somebody who's watching, but also people that have specific questions and needs. I think you've done a real service to people for addressing them. I kind of just talk generally about mental health. Like on my shirt it says, "Change is hope," meaning if you've done the same thing every day and you've woken up sick, whether it's depressed or anxious or whatever your mental health challenge is, chances are you're going to feel the sense of hopelessness that is pervasive. And the only way to deal with that is to change something. Make an appointment with a doctor. Look for an alternative therapy. Do something, because doing nothing isn't going to change anything. That's it. So thanks, guys. Appreciate it.
Yeah.
Thank you so
Andrew,
much, Michael.
James, Michael, that's it.
Take care,
Thank you,
folks.
Whole Health.
Thank you.
Thank you, Whole Health.